It's good. It's centralized.
All right. Hello viewers. Now today's topic is all about oral cancers, actually throat cancers. Throat cancers, their prevention, their treatment, how do we manage, like, early screening, how do, it's so important to know all this because it is so very common. Head and neck cancers is one of the most common cancers in India. And the three of us being ENT surgeons, we are seeing throat cancers every day in our outpatient. And more younger patients are also presenting with throat cancers because smoking and tobacco chewing is so common, especially in the northern part of India. In some states like UP, Bihar, Delhi, we have lots of people coming with tobacco chewing and cigarette smoking history. Some of them may present knowing that they have the cancer, and some of them, they're only screened while doing they're just coming for master health checks, like whole body preventive health package, and that's when we screen and we tell them there is a precancerous lesion or a cancerous lesion, and then they go for biopsy, etc. So this is very increasingly common. Now today we have two eminent speakers here, and they do a lot of work in their respective fields. Like, for example, Dr. Vidisha, she's associate professor in the most prestigious institute in India, that is Tata Memorial Hospital. So welcome, Dr. Vidisha, consultant.
Thank you. Thank you, Dr. Kalpana. Thank you, Dr. Neeta.
So, and Dr. Neeta, she's the chairman for a big association. She's been running this association since 2011. She's making great efforts to understand the hazards of tobacco chewing as well as smoking. And, not only creating awareness amongst the public, she's also into school programs, like, she's been educating students and public about all this and how tobacco causes cancers, how to prevent them. And if you're hooked onto tobacco, how to actually, come out of it. I mean, so many such things. She's been really working hard. So applause for both of these speakers today.
Thank you, Kalpan.
So let us start off, I'm sure the public has logged in. I don't know how many have logged in. Can you see Neeta and Vidisha, can you check on the Facebook live stream how many have actually logged in? Like, should we wait for some time to start, or do we have a sufficient number of viewers? Now, both these ladies are from Mumbai, and they have their own experiences, and we are going to listen to them, and they will be, talking to us about how these cases are presenting to them and what are the kinds of treatment that we are providing. Now, remember, viewers, it's very, very important to present early in cancers, that you understand. If you come in early stages, you'll have better prognosis, better chances of cure. Your outcomes will be certainly much better than when, as vis-a-vis presenting late. If you come late when the cancer is already advanced to the neighboring areas or to other areas in the body, then your outcomes go very less. I mean, the outcomes become very poor. And also with the new age technology surgeries, like we have robotic surgery, etc., happening for throat cancers, where in stage 1 and stage 2, you can even avoid radiotherapy and chemotherapy. Okay. So selection of cancers is really very important. If it's a T1, T2 lesion, just wide robotic resection is just sufficient for removal of the cancer, especially in cancers of the base of the tongue. You do not have to do a mutilating surgery like commando surgery where the jawbone is cut open. So please remember, present early, or else if you have family history of cancers, go for regular screening, or if you are in the habit of smoking or tobacco chewing, please see your ENT doctor once in a while as per recommendation. So let us start off with Dr. Vidisha's experience. So Vidisha, tell us about oral cancers. Like, what do you think the causes are? Oral meaning, I'm including everything, oral, oropharyngeal.
As in India, if I have to say, the tobacco is the commonest cause. And tobacco in many forms in India, it is consumed. Some people smoke, some people chew, some people use mishri, some people use snuff. And in various part of the country, we have various ways of using tobacco, and it's quite culturally rampant. So just to answer it in a short, tobacco is the commonest cause for causing oral and head and neck cancers. And if people are doing other habits such as drinking alcohol, they have an additive effect. That means if you are drinking along with using tobacco, your chances of getting cancer are multiplied.
Yeah, that's the synergistic effect. Yes, apart from tobacco and cigarettes, what about other causes, Vidisha? You know,
So
like
some
viruses.
other causes are some the viruses. So as you said, like in the cases of oropharynx and base tongue, most of the HPV is the commonest cancerous this thing that has come up. Certain other cancers are also responsible, but less likely in the oral cavity cancer, such as EBV, and less likely are the genetic causes, the trauma from the tooth, the chronic irritating dentures. When you have some ulcer which is not non-healing, these are other causes, and some skin conditions like lichen planus have been associated with the cancerous conditions, but they are less common as compared to the other prominent ones.
Right. Now, Neeta, what about you? Like, since you've been doing a lot of awareness through media, print media, social media, and TV, etc., you've been speaking a lot about anti-tobacco, tobacco hazards and how to prevent. And since you've been doing these campaigns, I'm sure you're simultaneously seeing a lot of cancers also and precancerous conditions like oral submucous fibrosis. You must be seeing a lot of patients.
Yes.
Please
Yes.
tell us. Please tell us all about your campaign and all about your society.
Okay, I'll just give a brief overview first about the tobacco burden, the tobacco use burden which our country is facing. Worldwide, smoking is the commonest form of tobacco use, but in our country, it is smokeless tobacco. So smokeless tobacco means tobacco which is used in unburnt form, either orally or nasally. And there are myriad varieties available. There's a societal acceptance also to many of these products. And some of these products include tobacco lime mixture, which is known as, in some parts, as khaini. Then there is tobacco, which is the ingredient of betel quid, which is quite a common social habit. Then in Maharashtra, they use tobacco as a dentifrice. That is, it is applied to the teeth by burning tobacco. That is called as masheri. So many forms of smokeless tobacco are available. There is a societal acceptance to it. And can I give you a rough idea of how much is the tobacco use burden? The Global Adult Tobacco Survey, the second round of which was released in 2016-17, it showed that overall tobacco use among adults, that is above 15 years age, is 28.6%. Though this is less from 6% less than the earlier survey, it is still a very big number, alarming number. And the predominant form is about smokeless tobacco, which is 21.4% adults are using it, while smoking is by 10.7%. So you can understand, Kalpana, almost twice the people are using smokeless tobacco as compared to smoking. And we really need to create awareness about smokeless tobacco in addition to smoking hazards. And there is also about 3.4% people are using dual tobacco, that is smoking and smokeless tobacco. So smokeless tobacco hazards awareness we have to create. We have to consider the regional products which are being used, and this awareness about smokeless tobacco has to be done. And most importantly is we have to create awareness that all forms of tobacco are bad. Any form of smokeless tobacco, any form of smoking is bad. Smoking could be in the form of cigarettes, BDs, hookahs. Any form of tobacco, smoking, smokeless is bad. It is not to be undertaken. That is the message that we have to give. And the most important thing is all types of tobacco habits can be quit. So this also awareness has to be created. And this is a very good platform that we are helping to create awareness that tobacco use is hazardous, and this habit has to be quit.
Thank you, Dr. Neeta. And in fact, the work that you're doing, we want you to, do this work even in northern part of India. We'll provide you more members. You can organize, have subcommittees here.
Wonderful. It's very
much more awareness. And we even write to the government
Yes.
You fund this and let us do some projects and so that you do not only
Absolutely. It's the
Maharashtra
need of
but
the
even
hour.
other parts of India.
Yes, yes, we want to do it all over. We want to do it systematically, nationwide dissemination,
Right.
because this needs worldwide, everywhere school programs and the work we are doing is, I mean, it's important. We have to do it in the Indian scenario, considering smokeless tobacco hazards in addition to smoking hazards. So awareness has to be created about all types of tobacco use hazards.
Right. Now, tobacco chewing, the viewers, as Dr. Neeta said, is more harmful than smoking, inhaled smoke. And have you heard of reverse smoking? There are certain, people in Andhra, they do reverse smoking, which causes palatal cancer. That's also very dangerous. Yeah.
Yeah, absolutely.
So, yeah. So, Vidisha, I'm sure you're, day in and day out, since you're doing only cancer work.
Yeah.
I'm sure you're doing lots of head and neck cancers. Now, out of all the cancers, what do you think, which is the most common amongst the head and neck cancers?
So the oral cancers are among the commonest. And if you look into the breakup of oral cancers, there are multiple sites of oral cancers. We will see most of the cancers of the cheek and the jaw. And that is because of this smokeless tobacco chewing habit, wherein people keep it in between their cheek and teeth. And they keep it there for prolonged duration of time, hours together, and that acts as a carcinogen at that point, and that is where the cancer starts. And along with their saliva, saliva is spreading into the entire mouth. That also has effects on other subsides, but we see the cheek cancers are the commonest, followed by the tongue cancers, which are becoming more common in women recently. That is one alarming factor, that the tongue cancers are coming more commonly in women who are even not addicted to tobacco. So that's an alarming trend that has been coming up recently.
Right. And have you been noticing the male-female ratio, which used to be so different earlier? Now
Earlier,
the ratio
yeah.
is changing, isn't it? Earlier it
Yeah,
used to
yeah.
be 15:1 something, and now it is 5:1 something.
Yes,
And
more
still
and more
men,
women are coming with this.
more and
So this
more
is
women are
also
right.
attributed to the changing tobacco habits in the society. Like the women in Maharashtra particularly, they use a lot of this jarda and masheri, which is very commonplace in particularly lower socioeconomic classes. So they start these habits quite young, like in 15, 16 year age, they'll start these habits and they develop cancers quite in their primes, 20s and 30s. These patients are coming to us when they have a full-fledged stage 4 cancer.
Right. Now, would you also like to say what symptoms and signs should alarm people, and what are the forewarning signs, so that the patients would know that they have to go to their ENT clinics as and when they get these symptoms?
Yeah, so the simple thing is keep looking into your mouth as you brush every day in the morning. So if you have an ulcer in the mouth that is lasting for more than 2 weeks, if you have a red patch that is bleeding, or if you have a tooth that is moving without any reason, you should be alarmed and see at least a dentist or a local practitioner. Also, other alarming signs are you are having any difficulty in swallowing. If you have the feeling of food getting stuck in the throat for more than, let's say, 2 to 3 weeks, you have cough into your sputum, or if you have any changes in your voicing or breathing, please do visit a doctor, as these are early signs of probably there is some lesion in your oral cavity and the throat.
Or a swelling in the neck.
Or a swelling in the neck. Yeah, that could be insidiously onsetting swelling in the neck. That would be a lymph node, but please do see the doctors at the earliest if you develop any of these signs.
Right, right. Now, for all the junior colleagues that are watching, they also should understand that most common cancer is the squamous cell carcinoma that is presenting. All the ENT colleagues,
totally.
juniors would know. But remember, we have even other types of cancers in the head and neck. You could have adenocarcinomas, you could have basal cell carcinomas. There are various classifications. So let us not go into that now, since even the general public is watching. But yes, for the junior colleagues, it's very important to do a thorough head and neck examination.
Yes,
because
totally.
they could be a double primary. They could be, more than one site of cancer. So everybody needs to do it. What happens is usually when patients come to you, people tend to ignore the regions like of nasopharynx, the piriform fossa. I remember recently we had a case of referred otalgia. But this patient has been diagnosed as elongated styloid process. Yeah. So many other treatments were going
other
on
causes,
and on. Nobody examined the piriform fossa, and there was a cancer there. So that is why a thorough examination is important, and this is for the junior colleagues to make it a habit. They should examine every bit of head and neck area in order to not to miss anything sinister. Now, Dr. Nika, tell me more about your kind of, I mean, what is the response like, other than creating this media awareness, etc. I mean, are you also giving them any particular treatment? I mean, in the sense anti-addiction, like are you sending them to rehab homes or you're giving them themselves? I mean, tell the patients what they could do if they want to quit tobacco.
Yeah, see, our national health program, there are a lot of government initiatives for quitting tobacco. And the National Tobacco Control Program, it is run at 3 levels, at the national level, state level, and district level. And they have tobacco cessation clinics, which are free in many of the government and dental medical colleges, government medical and government dental colleges. And the list of the free tobacco cessation clinics is there on the National Tobacco Control Program website. Also, there is a national quitline number, and I'd like to tell the viewers this. It is 1800112356, which is a toll-free number. Should I repeat it?
I didn't know this. Please tell this again.
1800112356. This is a national toll-free quitline number. Then there is also a Pan-India M-Cessation initiative to reach out to tobacco users who want to quit through text messaging via mobile apps. And one needs to give a missed call. I'll just give the number again, 011 2290 1701. I'll just repeat it again, 011 2290 1701. So if one gives a missed call on this number, then via text messaging, a quick help can be given. We in all programs, usually I'm working for children. So everywhere, many times children may come to us and during our program, we have a question answer session. So they ask us what to do if the parent is using tobacco. So we give this information during our program. And this information, many times for children, it's mainly counseling services which are needed. So we refer them to the school counselor or to these numbers where they can, the government facilities where they can avail of free cessation advice. Basically, tobacco quitting means it's mainly counseling, and if needed, medicines are to be given. And this is available at the tobacco cessation clinics. So these numbers, if all of us display in our clinics, or if they are mass media, if there's awareness created that tobacco habit can be quit, smoking and smokeless forms, then many people can avail of this benefit, And this is right now, we feel it's very important because in the COVID times, as everyone knows that the pandemic severity is more in smokers, spitting, many times smokeless tobacco users spit everywhere. So this spitting can also cause to the spread of this virus. So people who want to quit, if they can avail of these facilities, it will be very good because they will benefit in the long run from the tobacco use results. So tobacco quitting advice is essential and it should be displayed in mass media in regional languages so that everyone can avail of its benefit.
So Vidisha, now tell us on a day-to-day basis, what about the voice box cancers, See, as ENT surgeons, we understand that it can be supraglottic cancer, glottic cancer, subglottic cancers, but for the general public, you can give them a broad outlay of laryngeal cancers.
So as we say, the laryngeal cancers are mainly linked to the smoking of tobacco, but in Indian population particularly, we find a variety, what we call is a marginal zone cancer, which are more related to chewing the tobacco, wherein your juices of tobacco are going down your throat, and then the cancer develops at the junction of your windpipe and food pipe. So the major change, these are usually insidious in onset and they give you symptoms when you can have change in voice. That will be one of the earliest symptoms. That will be a persistent change in voice. Sometimes people develop difficulty in breathing. Or if you have a pyriform fossa, that is a marginal zone cancer, then you may develop a lump in your neck, which will be insidious in onset. And after that, you will start developing incidences of your dysphagia. And when these cancers are in advanced stage, they are going to block the airway and they are going to cause difficulty in swallowing. So these patients will probably present with acute difficulty in breathing, wherein we have to perform emergency tracheostomies and so on. So if I would like to tell the audience that if you have any of these symptoms which are not resolving with your conventional treatment, visits to your routine ENT doctor, please consult a specialist, get yourself tested, get your scopies done, and so that it all can be detected at an earlier stage.
Absolutely right. Like cancers in the supraglottis can be delayed because the presentation is, not so obvious. So
Yeah, you can.
lot many times, cancer in the epiglottis or cancer anywhere else in the supraglottis definitely
Yeah,
can be
you'll just
delayed.
have a nodal mass which patients ignore because there are not many symptoms, and when they present, they
Right.
are in quite an advanced stage.
Right. But at least when there is a change of voice or when there is difficulty in swallowing or even slightest difficulty in breathing, etc., please, this is for the general public to be aware that they should report to the ENT clinic so that we do our endoscopies and then we, screen your cancer early and give you good treatment.
Yeah,
Now,
and another point for women specifically, I would like to make a point of a Plummer-Vinson syndrome, which can come up with a post-cricoid cancer. And in India, especially, a lot of our women are anemic, they are nutritionally compromised. So this post-cricoid cancers are quite common in women. We see them predominantly in women, and men won't have this kind of cancer. So women should pay a lot of attention to it if they are having persistent sense of a globus in the throat or some difficulty swallowing saliva, some swelling in your throat. Don't ignore it. Please go and consult your doctor. That is especially for women.
Yes, that was a very valid point, very important point, Vidisha. Thank you. In fact, even in ENT clinics, not many times this post-cricoid cancers are missed. So very, very important for anemic women, if they have difficulty in swallowing, please go and get your thorough screening done. Now, what are the investigations you both follow? Whoever wants to take up, please tell us what are the investigations that you primarily do for oral cancers. Oral cancers meaning public. Again, I'll have to tell you cancers on the lip, cancers on the palate, cancers on the cheek, cancers on the floor of the mouth, and beyond. And so beyond is what? Oropharynx. That is, it can be in the tonsils, on the posterior pharyngeal wall or the hypopharyngeal wall. And similarly, the larynx, which we were talking about, supraglottis, glottis, subglottis. Well, there are more cancers in this region, like head and neck region, but we will not go into too many details because today we are mainly focusing on how to prevent it, how to screen it, and give you broad perspectives of the treatment. So let us, please tell us what are the treatments? Do you subject everyone to PET scan, or what is it that you, what is the scoring, the grading and staging? Please explain to the patient.
Yeah, so for the diagnosis, as we discussed previously, your thorough ENT examination is of utmost importance, wherein we will see exactly if you are having a lesion that is doubtful. For example, in the mouth, how big is it? What all structures it is involving? The second thing is we will have to get a biopsy. So biopsy is an important thing wherein you will need to confirm that this is a cancer. Or sometimes you may have some precancerous lesions such as a leukoplakia or erythroplakia. In those cases also we'd require a biopsy definitely. And once we have established that, yes, this is a cancer, the next step that we need to know is how far advanced it is. Whether it is just localized to your mouth, whether it is involving some other structures, such as whether it is going to your bone of the jaw, whether it is going to your skin, whether there are any spread of the lymph nodes in the neck, or worst case scenario, whether it has been spread to the distant parts of your body. So to broadly tell the general public, any cancer that is just limited to the oral cavity and it is not involving any structures such as the skin of the cheek or the jawbone, and it's not involving the neck glands, it would be considered as an early cancer. And anything that is spread to the neck nodes that is involving vital structures such as the mandible, it is involving deeper structures of your neck, or the skin involvement, those would be the advanced cancers. So imaging in form of CT scan and MRI is vital to give us this information. So it tells us how far deep the cancer is. And to answer your question, a PET scan will not be indicated in all of the patients because a plain CT scan with contrast and an MRI would be adequate in majority of the scenarios. We will ask for a PET scan for a very selective group of patients wherein we know that these cancers are likely to spread to distant part of the body, such as a hypopharyngeal cancer, such as a post-cricoid cancer, or wherein we can see the cancer is very advanced. There are a lot of nodes in the neck. In those cases, we would like to know if there is a distant spread. In those cases, we'll ask for a PET scan.
Right. Thanks a lot, Vidisha, for all the explanation. Now, Neeta, tell us, in school-going children, how much do you really see, like all these adolescent kids Are you seeing a lot of tobacco chewing or smoking or both of them? Or I mean,
Kalpana,
what is your
our main
experience? Or is it with along with alcohol?
our main experience, our main purpose of the initiative is to prevent initiation of tobacco use. So adolescence is the age where there are a lot of changes occurring in the person's physical body also, and mental in the mindset also, that they become more, they want to experiment with all these harmful substances. So we are doing a school-based program for adolescents to prevent initiation of the use. So before they start, before they think why they shouldn't do it, that is what we are trying to convince them in an audiovisual format. And we try to convince them that we explain what is addiction, what is tobacco use, why they shouldn't be doing it. And with the audiovisual format, with pictures, we share our experiences. That we repeatedly tell them that not even once they should experiment tobacco use, because the nicotine, the content of tobacco, which causes addiction, is nicotine, which is most harmful. So even experimentation once can lead to initiation of tobacco use. So we try to convince them that they should not use, even try once, how much ever anyone insists. And this should be followed at any stage of their life. Maybe when they go to university, maybe when they go for a job, or whatever stage, anytime anyone suggests to them to try tobacco, they should be proud to be tobacco free always. That is the main. And we share our experiences also about how what can happen if tobacco is used. And many times, what we are seeing is since we are starting at an adolescent age, that much the children are not coming up. I mean, it's a school-based program, so maybe there is not that much reporting directly to us. But recently, in this year, August, the Global Youth Tobacco Survey, the India fact sheet was released, and the tobacco use national among 13 to 15-year-old students were studied, and national average is 8.5%. And in some areas such as Mizoram or Arunachal Pradesh, it is about 58%. This first time that statewise prevalence of tobacco use among the school-going students has been studied. So we need to develop region-specific approaches and concentrate more in areas where the tobacco use among students is more. And most importantly is worldwide school-based tobacco hazards, smoking hazards awareness program have been reported to be effective in many of the medical literature. And in the Indian context, what we need to develop is awareness program for smokeless tobacco hazards in addition to smoking hazards. We need something in our context, in the Indian context, where the smokeless tobacco use is prevalent, especially in rural areas and urban slums. This is the predominant form, also in the lower socioeconomic strata. And another aspect of our initiative is that the adolescents they can see, usually when a child comes back from school, he shares what has happened. So this tobacco hazards knowledge can be shared with the other family members, and they can disseminate this information in the society while they also remain tobacco free. So it will be always advantageous. And this needs, our initiative needs consideration for systematic nationwide dissemination, because as Vidisha has just mentioned, that younger and younger patients are coming with oral cancers. It means the habit is being initiated much earlier. So we need to prevent the start of the habit. And the prevalence, as you know, Kalpana, us being ENT surgeons, India has amongst the highest number of oral cancer cases in the world, and these are preventable by, many of these can be prevented, because about nearly more than 50% of them are attributable to tobacco use. I think Vidisha will be able to give more details than me about this. So tobacco use prevention is...
Yeah, kudos to your work, Meeta. And hopefully, now your campaigns will become more and more evident, seen in the northern part of India also. I'm really very keen, and we're all going to support you. And a little information to the public is, the three of us, how we are united today. It is because we are members of Indian Women Otolaryngologists Association. This is a new association that has been formed. And more junior colleagues or anybody related to this branch, ENT surgeons, are most welcome to join. You may be in any part of India, so please, feel free and join our group. our group is going to be, achieving a lot of objectives very soon. We've just started with academic sessions, and I'm sure it's going to be beneficial to all of you. Now, Neeta, I mean, I'm sure you're seeing a lot of these habits in the hosteliers, especially, people, children living in the hostels, and peer pressure is a,
Yes,
major
yes, that is the
factor.
most important. Yeah, you've touched a very important topic, Kalpana. That is why we need school-based initiatives, because children are spending almost a 1/3 of their waking time in school when pre-pandemic times. Now things are a bit different. Uh, but a lot of their time is spent in schools. So schools can be the best place where this information can be given. And even if some child is using, this is the time, adolescence is the time when quitting would be easier. And the long-term harms will be prevented. And India has we are having in a very good phase where we have a very large youth population, among the highest in the world. And for the next 20 years or the next few decades, if you have to reap the benefits, we have to ensure that our adolescents are healthy. The health of adolescents, keeping them free from tobacco use, is a priority for all of us. Each one of us can do our bit by remaining tobacco free, by encouraging our surrounding people to be tobacco free. And if each one of us contributes, we can surely be a society where all are proud to be tobacco free.
Absolutely right. Now let's go to Vidisha. Vidisha, what about genetic cause? A lot of patients keep asking and they want to know, is there any genetic factor linked to these cancers?
So there are certain syndromes that have been described with the association of oral cancers, such as Fanconi's anemia, xeroderma pigmentosa, or the Gordon's disease, but they are very rare. They are seen in like 1 in 10,000 or something. But if you have any family history of a cancer, then I would urge everybody to be more cautious. If you have a family member who has had any head and neck cancer in the past, you should be more vigilant about your own symptoms, so that even if you have a slightest doubt, go and get yourself checked, so that you do not miss on to anything. And if there is anything, that would be detected at an earlier stage and it is easier to tackle there. So I would urge everybody to be aware of your family history. Although these symptoms are rare, they are known to happen. So you need to be aware about it.
Yes. The other cause we probably missed is, past history of irradiation.
Yeah. There are certain kinds of cancers, like if you have been radiated in childhood, for example, let's say for a lymphoma or any other type of blood cancers, these people are more likely to develop thyroid cancers, parotid cancers, like let's say 10 years down the line. So by the time they are in their 20s or 30s, they would be coming up with such cancers, with some lump in the neck, some swelling behind your ear. So these people need to be monitored. And in our TMX centers, we monitor these survivors particularly. So all these survivors, when they come for follow-ups, we need to look for second primary tumor formation. So if there are anything, then they get referred accordingly. So these survivors are also a group who would possibly develop head and neck cancers in future. Yes.
So are you at TMH also sending patients for HPV screening, and are you doing laboratory tests and also sending them for genetic screening, genetic counseling? Do you have those departments there?
We do have all these. We have a preventive oncology, we have genetic oncology. If you're asking about oropharyngeal P16 HPV testing,
yes,
that
HPV
we are
16 and 18.
Yeah, we are doing it for oropharyngeal cancers definitely, because it changes the prognosis of these cancers considerably. If a cancer is a P16 positive cancer, it's going to fare much better than the ones who are HPV negative. So we need to have that information. So we do test, and some thyroid cancers are familiar, such as medullary CA thyroid. For them, we have genetic clinics. And if we are suspecting such like a non-addict patients who have never experimented with tobacco, they come up with a cancer, we need to know what is their genetic profile. So such patients are subjected to NGS and the genetic counseling, and we do genetic testing on these patients.
Right. Just in simple one line, please tell the public what kind of biochemical test are you going to ask them to do, because there may be viewers who want to know what is this HPV test.
So HPV test,
virus, yeah, please tell them.
Yeah, HPV test, it is usually done on a biopsy specimen, and then we just do what we call in our language is a immunohistochemistry. When we take your biopsy, we do certain kind of special staining methodologies which tells us whether there is virus in that tumor or it's not there. So it's a simple test done on the biopsy, and if you have the history of oropharyngeal cancer, we would like to do that on the sample.
Right. No, apart from this, viewers, there are even other viruses like HIV virus, Epstein-Barr virus,
Yeah.
So there are several causes, like there are even melanomas, excess exposure to UV radiation, etc. So there are lots of causes, but most importantly, as Vidisha has already pointed out, is a painless ulcer, non-healing ulcer, or a loosening of tooth. A lot of people are wearing dentures in your families. So make sure dentures are not ill-fitting. A loose denture, please, then that's a warning sign. A sharp tooth or a loose tooth, that may be a warning sign. So, most cancers, they're not painful. So, this general myth that public has is anything painful is more serious. Unlike what we know as ENT surgeons, the painless lesions are more harmful, and painful ones are usually infections which can get treated off easily. So please remember, painless swellings in the neck or painless non-healing ulcers, please do see ENT surgeon in your vicinity. Now thank you, Vidisha, and thank you, Neeta. Just, I want both of you to finally summarize for the public, let them take a message home today. So strongly, if you have to both give 3 points, please start one by one. 3 points, Vidisha.
So if you have any symptoms that are suggestive of oral cancers, please don't ignore them. That is a ulcer in your mouth that is not going away for more than 2 weeks. Any change in your voice, please get them investigated. If you catch your cancer early, you are more likely to get successfully treated with much less morbidity. And prevention and screening is extremely important, as so is the tobacco awareness, which Dr. Neeta will definitely allude upon today.
Yes, Neeta, 3 points of yours. Highlights.
If using tobacco, please quit. Quitting tobacco at any age is beneficial. All forms of tobacco can be quit, smoking and smokeless. Take the helpline numbers, take help of the quitline numbers, and please quit tobacco. The most important is we need to protect our adolescents and students so that initiation of tobacco use is not done, and we need school-based initiatives to create awareness about tobacco use hazards so that adolescents don't venture to try out also tobacco. And we must go towards so we must be a part of a society where each member contributes by being proud to be tobacco free.
And Tata Institute, Tata Memorial Hospital offers fellowships, my dear junior colleagues, if you're not aware of it. So you can contact Vidisha for any kind of guidance. So please,
yes,
anybody
totally
interested in head and neck oncology,
yes, we would definitely encourage. We would definitely encourage all ENT surgeons who are aspiring to treat head and neck. You should definitely get treated because it's one of the major problems of our country, and we are always there to help. If you need any guidance regarding where all you can get trained, what are fellowships, there apart from TMH, there are multiple institutes that are offering fellowships, short-term
like
fellowships.
Hospital, etc.
Yes, absolutely. Like Amrita has short-term fellowships in Kolhapur Cancer Center. In multiple centers you can have head neck fellowships. So if anybody is interested, please feel free to contact at any point of time. Ever happy to help.
Right. So this is a small tip for career guidance. And no, we haven't even touched the treatment aspects because they can be traditional surgery, they can be laser microsurgery, they can be robotic surgery, other modalities of treatment like radiotherapy, chemotherapy, etc. But we were all wanting to tell you that earlier, the better. So thank you, viewers, and anybody can feel free to write to all of us on this Facebook Live program. If you have your questions, please shoot, and we are here to answer you. So you can even follow the recorded link and let us know any questions can be answered. And we must thank the eminent speakers who have given their precious time today. Thank you, Dr. Vidisha.
Thank you, Dr. Neeta.
Thank you, Kalpana. Thank you, Vidisha.